Friends, my clock says hi. Thank you so much for joining us today on our monthly Renville County HRA EDA Lunch and Learn. As mentioned, this is a monthly occurrence, every month, different topic. When we are doing this in normal times, we try to do this at a different location each month around Renville County, but with the pandemic, we moved to an online only format. So no lunch today. Sorry, we didn't have Santa Claus out delivering all of our meals today. So hopefully in the next year that we'll be moving back to an in-person format, and then we'll cover lunch for you. Hope to see you all on that coming up soon. So our topic, and I guess the 800-pound gorilla that everybody's dealing with these days is COVID-19, and it's affecting every business a little bit differently. A few minutes ago, we were just chatting, how it's affecting your business and what kind of turnout or what kind of folks being out sick, what percentage and that kind of stuff. So we thought it'd be a great idea to bring in our experts from Renville County Public Health to talk about what businesses need to know when it comes to COVID to help protect themselves, their customers, their community. So we've invited Jill Bruns. Jill is our Renville County Public Health Director. Her background is she's got a public health nursing degree from the University of Minnesota and has previously worked for another county. She became director of Renville County Public Health in about 1984 when she was in 7th grade. So with that, we would like to welcome Jill and her team and everyone from Renville County Public Health. So welcome, Jill. Thanks for making it today, and we'll turn it over to you.
Thank you so much. Yeah, it's pretty humbling when I'm hiring people that could be my grandchildren. But that's a good thing. It's a good phase in life to be. So thank you so much. I have truly enjoyed public health. I just have to tell you all that we have trained for this for like 20 years. We've been working in emergency preparedness and always the possibility of a pandemic. But I have to tell you, I never imagined it at this magnitude. So it's been a trying year for all of us. And I've had many sleepless nights worried not about just the vulnerable, but the children and the businesses and the unemployed. So it's been a really tough year. And thank you all for hanging in there. Just kind of a current situational status. This morning, our numbers, we are at 1,120 confirmed cases since the first part of March. 365 have been positive in the last 14 days. We are at 32 deaths currently. So what happened at the end of October, Renville County's numbers were at 288. So from October 31st until today, we went from 288 cases to 1,120. And I mean, that's kind of in line with what's happening in our state and kind of in the Midwest in general. But we know that there's been exponential growth. And that's one of the reasons we're even talking to you today. On a bright note, it appears the last few days our numbers may be going down a bit, but we can't let up our guard, or let it down, I should say. So just a little bit. I mean, you guys know, you've heard so much about this, but the germ, it's a virus, and it's primarily airborne. We've learned so much since March, and so guidelines are changing, especially at the beginning, very, very frequently. But even this week, we had a change in some protocols. So things are changing as we learn more about the virus and what it all does. So initially, there was much more concern about surfaces. And I'm not saying that we still shouldn't be guarded about surfaces, but we know it has spread much, much more so through airborne contact. I didn't do a PowerPoint today because there are good documents on the Minnesota Department of Health web for businesses. So I'll share some of them and we'll kind of go through some of them. Okay, I'm not finding what I need here. Remember, I'm close to retirement, so I could be a little technologically challenged at times. Okay, there we go. Okay, so just a little definition of what a close contact is considered. Again, this changed a few months ago, so it's defined as spending a cumulative, not just at, it's cumulative over a work day or 24 hours of 15 minutes or more within 6 feet of someone who has COVID-19 during their infectious period. So that includes if you're wearing a mask or not, it doesn't matter. It's that 15 minutes or more within 6 feet over the course of the day. For businesses, a coworker can be exempted from this definition if during their period of contact, everyone was using a face shield and a face covering, or if someone was using a face covering and there was a physical barrier between them, such as a full plexiglass screen. So just for your benefit, I mean, it's just good to know what a close contact is considered. So people with COVID-19 can give the disease to others 2 days before developing symptoms and until 10 days after their first symptoms show. So that's coined as the infectious period. Therefore, the contact tracing, we'll talk a little bit more about that later, should include coworkers who are exposed to a worker with confirmed COVID beginning 2 days before the person's symptoms started, or if they don't have symptoms, 2 days before their confirmed test. In the new updated guidance, this was just updated on November 30th. They have some neat diagrams here that show that if workers are using both face coverings and face shields, or have that barrier between them, if any of these workers turned positive in this figure 1, they would not have to be quarantined. A close contact would not have to go into quarantine. They would be considered safe. In this situation, just with face masks, if any on either side of the plexiglass barrier was positive, the one standing next to them would have to be quarantined. But because there is that barrier, I mean, it could be a wall, it could be plexiglass, so on and so forth. But here, I think it's illustrating plexiglass, and they're probably within 6 feet. Those on the either side of the plexiglass wouldn't have to be quarantined. So that was a neat illustration, and I will send these links to Jordan to share with you all later. Then I just wanted to again talk about, I don't want to make it dizzy here. So what's the difference between the isolation and quarantine? And a lot of people think quarantine sounds worse than isolation, but isolation is much more constrictive for people. So isolation is for people who have tested positive for COVID-19. And they have to self-isolate at home for 10 days. And they are considered infectious during that whole time. They could return to work if they have no symptoms, after those 10 days, and they also are fever-free for at least 24 hours without any medicine to reduce that fever. So for the most part, those who are infected would be out 10 days. They might still have some lingering symptoms, and they are not to return until those symptoms are gone. The one thing that people don't understand about isolation is that they can infect people for those full 10 days. So when public health is doing some of the COVID coaching, where we are attempting to contact most that tested positive, we tell them, if at all possible, the positive person should be in that self-isolation at home. That means in their own room, not commingled with other family members, not sharing space, ideally not even sharing a bathroom. If they have to share a bathroom, they must disinfect it after their use. If they have to go to the bathroom, they have to wear a mask and stay at least 20 feet away. Some people have reported, well, I've stayed in my bedroom most of the time, but in the evening I get bored, so I put on a mask, and me and my spouse sit in the living room and watch TV together. No. Self-isolation means you really do stay in your own room or floor. I mean, I had that advantage personally. I had a whole floor with a bathroom, and my husband brought my food up the stairs, and we had no contact. The reason for that is that family members would need to next go into quarantine because they've been exposed to the germ. They can be exposed those full 10 days if they are commingling. And sometimes it has to happen. Maybe they don't have a big enough house, they don't have enough bedrooms, maybe they're a caregiver of a child or whatever, they can't. But if there's any way they can isolate, then that diminishes the quarantine time for families. Because for quarantine, anybody who is exposed to that germ is, quarantined for 14 days after exposure. Now, if you're commingled in a household, that your quarantine period would start after day 10 of that person's infectious period. So there are some people who literally could be quarantined for 24 days watching for symptoms. So quarantine, again, you were exposed to the person who tested positive. You're kind of waiting during that period to see if it's incubating, if you go on to develop the disease. At work, that the last contact should be the last time the person worked, and up to 20 or the 2 days before they showed symptoms or were tested. But they may have worked with symptoms, so you have to start counting the day of quarantine for those employees, the last that they were exposed. One of the questions that we sometimes get is, what about while they're waiting for results? So if somebody has symptoms and they have a test, they really should stay at home just so that they don't expose other people while they're waiting for those test results. I wanted to, I'll stop sharing now if I can figure this out again. Just with the new guidelines that just came out from the Minnesota Department of Health. Okay, I'm sorry, this is a little hard to see. Let's see if I can make it a little bigger. Okay. So this is talking about the new guidelines, the CDC. It's been in the news a few weeks, and the Minnesota Department of Health formalized this recommendation just a few days ago. So for quarantine, the 14-day quarantine still pertains if you're living with somebody in your house that has COVID, you still must quarantine for 14 days. After the last exposure, you remember, you see that little red day 0 is exposure. Hopefully, if they are totally isolated in their own bedroom or whatever, that day 0 could of that person's isolation period. However, if you are commingling, that day 0 starts on day 10 of the infectious person. The 14 days also pertains to people living like in long-term care and healthcare workers. They are still recommending the 14-day quarantine. So the good news for business are some of these scenarios. So if it's a contact at work, their last exposure was the day that they were exposed at work. So they're sent home in quarantine. That has been shortened to 10 days for workers. They can return after the 10th day. They need to continue watching for symptoms until day 14. About 97% of people will develop symptoms by the end of day 10. So I think that's one of the recommendations. There are some that do go on day 11, 12, 13, 14, but it's much less likely. Then there's another option for a 7-day quarantine, but that does require a negative COVID-19 test. And so the test can't be done before day 5 after the exposure. Unfortunately, sometimes it takes longer than 2 days to get those test results, but it could shorten the quarantine for your employees. Okay. Thanks for bearing with me, everyone. Okay, so we're going to go back to what to do if you're positive. Again. Okay, so for businesses, contact tracing should begin as soon as an employer is aware of that employee that is tested positive for COVID and that they worked while infectious. So remember, you have to look at the time frame. Determine the time frame. Look at the 2 days before the first symptom occurred with the employee through their last day of working in your business. For workers who tested positive but never had symptoms, you need to use 2 days before their test through their last day of work. And then really look at what activities the employee was doing at the time. Besides just work, were they carpooling? Did they take breaks together? It might not even just be people that are working right next to them, but it could be other activities throughout the day. And again, try to discourage them at this time of just kind of exponential growth. We want to minimize that kind of activity. And then you really identify those who meet that definition of that close contact, the 15 minutes within 6 feet, masked or not masked, throughout the workday. So then they should be required to quarantine at home. So that's kind of what you need to do as you kind of determine who needs to be considered a close contact and in quarantine. Mary Kay Sinner is with me today, and she's my scientific guru in public health. I love Mary Kay, but one of the most frequent questions we get is about a contact of a contact. Mary Kay, will you kind of explain that whole situation?
Certainly. So the person with COVID, we call that person COVID, person one. The household contacts of person one, those are the people who must quarantine for a full 14 days. And even with the new guidelines, the household contacts, they still have to remain in quarantine for 14 days. They cannot test out of quarantine. The next circle is the close contacts. So the close contacts are just what Jill said, people who have been within 6 feet for 15 minutes, some total in a day. And those people are those are the people who the new guidance applies to. So that would be the 7 days with a test on day 5 or the 10 days without a test. The contacts of the contacts are people who worked with the dad of somebody who got COVID, or anybody who's just a contact of one of those other, not of person one, but of the household contacts or of the close contacts. So many people have been worried about, well, I have had some contact with that person. Not if you don't meet one of those other definitions. So it's very easy for us instantly to say, nope, that person can just continue living on their life. That is just a contact of a contact.
And I think businesses have called us at times, Mary Kay, to say, okay, the wife of our worker was exposed, and now he wants to be excluded, and he does not have to be. If she would turn positive, then absolutely. But we often get questions about those like peripheral contacts of contacts that are not confirmed yet. They're watching to see if it's incubating and if it turns into disease. But I think that's the most common question, Mary Kay. Yeah, so.
Something I'd like to add that I just had heard on the MDH call was that if the close contact gets tested on day 5, that test must be a PCR test. So it can't be an antigen test. It can't be the quick antigen test. It has to be a PCR test, which that can be nasal, it can be nasopharyngeal, it can be throat, it can be saliva. All of those are PCR tests, but the nasal or the nasopharyngeal that just you get the results in 10 or 15 minutes, those do not count toward decreasing your quarantine.
That's something new for today. Okay, so this is another document about critical response for the businesses. You all were to have a COVID preparedness plan last spring. And all those plans sometimes sit on the shelves. Well, this is the time that they need to come off the shelf and really be reviewed again. But I was on a call this last week, and they said, really, businesses, you have to consider everybody, even in the community, as being infectious. So it's important that businesses really step up their plans. So the most important actions that employers can take to minimize the spread of COVID in the workplace, first and foremost, is that systemic employee screening, and to really ask them questions. Mike Hennon, our Renville County Emergency Operations Center, he works with me. He sits on the state calls, and they were pleading for businesses to really start doing that systematic employee screening every day. Doesn't mean you have to keep all those records, but just to take it seriously and to exclude people that are showing any symptoms and encourage them to get tested. So besides the screening, support that testing of symptomatic people. really adopt those physical and operational changes, you know, the spacing requirements, those kinds of things. Mandate those face coverings and appropriate other personal protective equipment. So, and then just to assure that there's adequate cleaning and disinfection of those common areas. So, okay, I'm sorry. It says something's paused because I have another message. Okay, there we go. Hopefully that did it. There, are we back? Sorry about that. So if you screen everybody, it really does help. I mean, it talks about sore throat, cough, fever, muscle aches, shortness of breath. There is a form that the Minnesota Department of Health has, and I can again send this to you. It's a very, I mean, like I just returned from the dentist, and this is exactly what they had for me to review before I came to the dentist. So this can be done with every employee. It's kind of what we recommend, and to eliminate them, and also really to encourage people to get tested and to allow that exclusion if they are sick. So I figured it would take about a half hour, and then we want to open it up for questions for anybody.
Friends, any questions for our public health team, Jill and Mary Kay? Pat, it looks like you're talking, but we can't hear you.
Okay.
Carol, did you have a question?
I do have a question. Jill, if you could go through one more time the contact, the close contact with people and how that works even with critical infrastructure, because what I thought I heard you say was that if we have two employees that are in close contact with each other for 15 minutes or longer a day, which we would in our sector, they're wearing masks. If employee A tests positive, are you saying employee B has to then quarantine?
Absolutely, yes. Yes.
Thank you.
If they wore, yeah, no, if they wore that mask and a face shield, no.
Yep, they need
Okay.
to ply on then. Okay, got it.
Oh, Pat, we see your mouth, but not your voice. I'm sorry. Maybe you can type it in chat. Is there a chat feature here?
Yeah, I think there's a chat feature here. Yep. Any other questions?
See, otherwise, Pat, if you want to shoot me a quick email with your question, I can read it aloud to Jill.
Don't you love technology, Pat, right? Any other questions?
So sometimes it's easier to do some scenarios if because we certainly have been doing a lot of COVID coaching calls and a lot of questions from businesses, and so I think that if we would welcome any questions, but if you don't have any questions, I think we should start with a scenario. So scenario number one would be you've got 3 employees working together in one room. 2 of them are fairly near each other. The other one is really way across the room. Everybody is wearing masks the whole time. Person number one, gets symptoms, stays working for several days, but the symptoms get worse. and finally goes and gets tested, tests positive. The company, the business, has to go back every single one of those days that the employee was working while they had symptoms, plus 2 days before that. So let's say it was a Thursday that they finally got tested. You'd have to go back, but let's say the symptoms started on Sunday. You'd have to go back all of those days that the employee was working with symptoms, as well as back to 2 days before Sunday would be Friday. So anybody who worked with that person on Friday, Monday, Tuesday, Wednesday, or Thursday. That is why it is so crucially important to what Jill said. Screen your employees every day and don't have anybody come to work when they have any of the COVID symptoms, and have them stay home right away when they get symptoms, test immediately when they get symptoms. They'll have to stay home for the 2 or 3 or however many days it takes to get the results back. But then if they test negative, they're right back to work and all is well. If they test positive, that person who worked near would have to quarantine for either 14 days or 10 days and not worry about a test, or on day 5, if they got a test and that test was negative and they got their results back by day 7, then that other employee could come back on day 7, but have to monitor their symptoms extremely carefully, because it is still likely that they will get symptoms and become infectious, and then they would become a person 1, and the whole tracing would start back over. So the new guide, by the way, the new guidelines, there is not new science. The science is still the same, and they actually strongly would prefer everybody to quarantine for 14 days. They just know that people don't do it. And so behavior, they said, the epidemiologist said today, it's behavioral science, not biological science, that had them change the recommendation to 10 days instead of 14 days, because people are not doing it. So at least if they are super strict for this amount of time, it will be more, hopefully more compliance and less spread throughout all the businesses.
So Mary Kay, we have numerous questions down in the chat. So Pat was wondering about apartments. Is there guidance for apartment buildings on best practices? And then would a landlord be notified if a tenant tests positive?
The answer to that is, if it's a long-term care facility or any kind of facility where the residents are right with each other, the facility would be notified. An apartment building, no, because you have walls. So it would be just like a person confining themselves to a bedroom. You would not, in an apartment building, be notified, and you would not quarantine unless somebody knew that they were using the laundry room at the same time as the COVID positive person, and they were down there for 15 minutes and they were in close contact, or they were visiting. But not just by living in the same apartment building would you have to quarantine.
And that doesn't mean that that person is going to share that information with their neighbor. We really encourage them to do that. But it's just like any other contact tracing public health does. Sometimes it's only as good as the information they provide to us. So, and the specific, there isn't really any specific recommendations for apartment buildings. Perhaps cleaning doorknobs more and common areas, those kinds of things, Pat. But
laundry rooms and doorknobs, very much so.
Yeah. So Jen Visser asked if you have an employee that travels, how long before they return to work? I know that the Governor Walz had recommended if you travel out of state, it's 2 weeks. I kind of chuckled at that personally, because I think we're maybe more at risk to the rest of the nation than because of our high numbers. But that's a really tough one, because Jen, it so depends on what they do. If they have an Airbnb and they go to Iowa to spend a weekend just to get away is different than if they go to Disney World or whatever. I again, that's a really hard one. I don't know if do you have any strong recommendations, Mary Kay?
So we had a long conversation about that in our office, and it is a recommendation, not a requirement. So isolation and quarantine are requirements. You must. It is executive order. It is law. You must. So you don't. You can't not do that. You can't just say, well, that doesn't apply to us. It does apply to you, and you have to do that. The travel quarantine is a recommendation. But I'm going to completely agree with Jill. The schools have asked this question nonstop about if their teachers travel, do they have to quarantine when they get back? Do they have to at least teach distance learning? Or the students, do they have to learn distance learning if they do that? So I'm going to say exactly what Jill said. If they were in a very low risk activity, then no, we wouldn't even push that recommendation. If they were in a high risk activity where they were on an airplane, or if they were in contact with people, then it would be such a very strong recommendation. And that is your choice as an employer. That is a school's choice as their school policy, what they will choose to do.
Next question from Brandy Fisher. In regards to wearing masks and shields, do the shields have minimum criteria? Like, do the shields that sit on the chin and really go only up to the bridge of the nose work as secondary protection?
I have a direct answer for that one. The MDH epidemiologist has addressed that exact question. So the kind that sit on your chin and go up to here are absolutely not allowed. They do you no good, because what they do is your air goes up and up into the air. So it just spreads in the air, and it probably does more harm than good. The reason that you want a shield that goes all the way down clavicle to at least
from your forehead, right?
From your
like
forehead,
from your forehead down.
all the way down to your clavicle. It forces any air that does get past the mask and then past the shield to go down to the floor. And that is what you're trying to do, is get the air particles to get to the floor as quick as possible. So the answer is definitely there is definite minimum criteria of those masks, of those shields.
Great questions, guys. I appreciate, we love the questions. So Jeanette Wordish asked, should employers be taking temps of every employee before starting their shift and then recording them for trends rather than just the number? For example, someone could have a normal temp of 97 for days and then they're at 98 or 99, and that could be a trend. You can take it, Mary Kay.
I love the trend idea. The employer does not have to take the temperature. You could have your employees tracking their own temperature. The employees could be required to write them down somewhere. But the trend is very interesting, because it is true that there are people who run at 96 or 97 all the time. And if they jump up to 99, that is a significant change and a probable symptom. MDH says that for school exclusion, they still do not have to be excluded unless their temperature is 100.4 or have one of the other symptoms. So when you're screening your employees, if they had a temp of 99, they probably need to have one more symptom, like a cough, like a runny nose, like a nausea. You know, one of the other COVID symptoms. You would usually have two symptoms if the temp was not above 100.4. If it's above 100.4 all by itself, that would exclude them.
You know, there are some situations where it's required to kind of keep those logs. However, it is HIPAA protected. It's health information, Jeanette. So you would have to get permission to actually keep and record that data, unfortunately. There are some like Medicare certified facilities that must, but for the most part, most businesses, it's considered HIPAA protected. So just beware of that. I would recommend personally doing the self-monitoring of employees rather than recording and keeping those records at your employment.
You can require the employee to keep them in a file in their own drawer that they would have to hand to you or that they would have to consult when you are asking them how long have you had any of these symptoms.
So another question is, can an employee wear like a shield without a mask? Instead of a mask, could they wear a shield?
The epidemiologist has directly answered that question too. Masks are the most impactful because they're right over your face and stop the particles from spreading. A shield, the particles still come out, hit the shield, but there's still plenty of space that the virus particles can go. So shields are better than nothing, but not as good as a mask. A mask and a shield together are great. There are times when for instance, teachers, when teachers are lecturing and they're really having a hard time getting across the lesson, they may remove their mask and just leave their shield on. Teachers do both. Teachers have a mask and a shield. So there are times when a student really needs to be able to see their mouth moving to get the message. Also, children with special needs. Sometimes a person might choose to only wear a shield in that case. But in general, you would want to wear a mask over a shield, and you'd want to wear both in many circumstances.
Sue, it looks like you have a question. Yeah, go ahead. Say, Sue, is there any way you can type your question? Because you're really cutting up. Yep, the audio is, yeah.
While Sue's typing, I got a question for you, Jill and Mary Kay. My folks are senior citizens, and I try to get out there and help them out as much as I can. What are some of the best practices? When I come in, I quick run down to the shower in the basement and take a rinse off shower and put on clean clothes when I go upstairs. Tomorrow I'm going to put up the Christmas tree and some of that kind of stuff for them. What are some other good best practices after I've been in the office working all day, or should I not go there at all, or any thoughts or guidance? And I'm sure there's other people in roughly the same boat as I am.
Oh, Mary Kay, how do we answer that one?
Sorry, I should have prefaced this. Long-time listener, first-time caller.
Again, that the recommendation to anybody at high risk is, even socially, you're encouraged not to visit at this time. I guess if you feel like you must, if you, definitely a mask, and they should also be masked and try to keep your distance. Maybe even more ideal was what we're talking about today, Jordan, with both a mask and a shield, as you're in contact with some of the most vulnerable. Yeah. So
Gotcha.
I don't know, Mary Kay, if you had something to add, but I mean, that would be my recommendation.
I agree with everything Jill said. Wash your hands and wear a shield. I mean, wear both wear a mask. Stay really far away. I mean, like 20, 30 feet away. Do not hug them, and don't go if you don't absolutely have to, because if you brought COVID into their house, like Jill and I both have experienced with our own mothers, and not that we brought it to them, but this would be the
I gotcha.
time to not go.
I gotcha. Thank you.
So Sue, Thomas, it looks like you're a rock star. So she just wanted to share that they do a check each day with thermometers that are available, and every pen and thermometer are sanitized after use. And employees keep their sheet in a file, and supervisors can spot check to be sure they are being completed. So everything is set up right at the entrance to every office. So sounds like you have a really good system, Sue. And hopefully you are catching people. But besides just the temp, it's those other symptoms too. Some people don't ever have a temp. So it sounds like you're doing a good job. Any other questions? Oh, here from Michelle. I don't know how to say Maratsky, is what I'm going to say. If you have had COVID, are you still contagious? And what precautions should that person take?
If you
So,
are if you
go
are a
ahead.
lab confirmed positive case of COVID, you have 90 days where you, after your isolation and all of your symptoms are gone for 24 hours, then you are no longer infectious and you don't have to do any isolating or quarantining for 90 days unless symptoms return. If you start having symptoms again, you have to go home and stay home during your symptoms. You don't even have to retest because many people continue to test positive for many of those 90 days. So you don't have to retest. You don't have to, like if you're a close contact of someone or a household contact of someone, you don't have to quarantine. For 90 days, you get a stay out of jail free card.
You know, one of the things I realized is that if you're in a household and someone is sick, sometimes other people start showing symptoms and they say, well, I'll just write it out, I'm sick. You need that lab confirmed test to be excluded from quarantine even at work in the future. So for that 90 days, if you have exposures and don't have a lab confirmed test, you have to quarantine. So it's a real benefit for businesses to have employees screened with symptoms. If they are positive, they'll quarantine, but then they really don't have to be quarantined again if they have any exposures in the future. So it's a benefit. It's a win-win for both the employee and the business too.
Can 2 recent COVID positive households get together? Yes, if everyone in the household was positive. If they weren't, like we had this situation where let's say there's 4 people in the family, 2 people will have been COVID positive, the other 2 will not have been. Those two who are not COVID positive are still at risk, and you could start the whole thing all over again. But yes, if every single member was COVID positive, confirmed, lab confirmed COVID positive cases can hang out together during the 90 stay out of jail free time. Yes.
There's a question from Carol Maurice about the cost of the vaccine and whether employers will be able to offer it on site. Will MDH or Renville County Public Health be able to provide administration on site? I'm not sure yet, Carol. I believe the vaccine will be provided free of charge. There could be an administration fee by some providers. I don't know what kind of capacity we will have to go to individual businesses. I predict we will be having more public clinics. But hey, that it could change. Stay tuned is what I want to say, because I can't make any promises at this point. But yeah, it's around the corner. Hospitals should be getting some of the very ultra cold vaccine that has to be stored like minus 60 degrees Fahrenheit. So, and they will be administering it to the hospital staff. Public health and pharmacies will be getting some of the very other vaccine the end of December that's frozen. So the stuff, because it is extremely fragile, so it has to be maintained at good temperatures and once thawed, used fairly promptly. And because of that, Carol, we may not be going off-site a lot just because of the stability and the handling of the vaccine as we transport. But again, I'm not sure. Brandy Fisher wants to know, can you share what's the expected response to the vaccine? I've heard that people have COVID. Oh, I'm sorry.
18-year.
Oh, I'm sorry. I did. Yeah. Is it only for those 18 years and older? I believe at this time it is, correct, Mary Kay?
Yes. So the studies that were done were all adults because they don't usually do studies on children until they know that it is safe on adults. So but it will be very easy for them to add the kids when they're ready. So the kids will not be the first, that's for sure. There will be many other priority groups that will be given before the kids would be receiving them. So the kids will not receive it. I'm hoping they can get it by the fall, but we'll see.
Yeah. And the expected response to the vaccine, and you've heard COVID-like symptoms from the vaccine. I have heard also that some people they call it a robust response. So I'm wondering if I don't know if that's localized or more generalized. I haven't heard a lot about that, except that people are having some reactions. I mean, a flu shot, often you'll get maybe a tenderness at the site. Sometimes people feel kind of flu-like for a day or two afterwards, but Mary Kay, do you know more about that? Have you heard more?
No, I think it's just what you're saying, Jill, is every vaccine actually impacts different people different ways. And like Jill, describe your shingle shot, you and Steve.
Yeah, I had no problems. I mean, I was a little sore. Steve was in bed for 2 days after the shingle shot. He just felt punk. Received it the same days. So again, two different people, two different responses.
So it would not be at all surprising if some people have some kind of response to this. Now, the whole point of it is it will keep you from dying. It will keep you from being in the hospital. It will keep you from having low oxygen saturation. It will just make you if you have that response, it might make you feel a little not great for a couple days. But many people, I'm assuming, will have no response at all, just like most people don't have a response to the flu shot.
Boy, Carol, you're asking us some questions we don't know. Are there any timelines associated with the feeling symptoms and then receiving the vaccine? So you're asking, I'm not real sure what you're asking, Carol.
Sure. So what I am asking is if I had symptoms like within the last 5 days, can I go get the vaccine? Is there like any period of time that I have to be quote unquote healthy before I get the vaccine?
We don't know that yet. I mean, that all of that
Come on, Mary
comes out.
Kay.
It comes really specifically with every vaccine we give. It's written out to us exactly what we have to ask every person. So,
Okay.
like flu shots,
Sure.
you can't give a flu shot if you have had a fever in the last 48 hours or something. So there will be very specific guidance, but we do not have it yet.
Thank you.
Carol, like one of my questions is, there are now 1,100 and whatever in Renville County lab confirmed COVID. Are they lower on the priority list, even if they're in a high risk group? I don't know the answer to that one yet. I have a lot of questions too, so. Okay, I know we're getting close to time. Anything else? You've been an attentive audience. Thank you.
And thank you, ladies, so much. We greatly appreciate you coming in. As mentioned, this event has been recorded. We're going to end up putting this on our social media accounts here, probably yet today or tomorrow, for those that may have missed it. And I'm sure, like you ladies said, that things have been changing, and latest announcements are coming out almost on a daily basis. So perhaps down the road, we'll maybe try to do another one of these again. But please follow, we encourage you to follow Renville County HRA EDA, the public health social media accounts for the latest news and information on this, or Renville County. They kind of do a good job of rebroadcasting everything. So on behalf of Renville County HRA EDA, thank you so much for attending, and good luck, and be well, and follow the precautions, and hope to see you next month. Thank you.